you're healthy. Maybe that's the problem.
When does the government actually come in and help pay for long-term care? And what does that look like?
Medicare doesn't exactly cover what we are calling long-term care.
Sitting down with a potential client and they say, yeah, I don't think we're going to need it, / I'm going to self-insure.
Self-insure means that you're transferring the risk to yourself. So it's kind of an oxymoron.
What is the most ideal time, age that people should start investigating to see if long-term care strategy is appropriate for them?
People don't realize your health span is shorter than your lifespan.
Many of you that are watching this have already seen firsthand while caring for a parent or a loved one. You know the emotional toll, the financial strain, and the hard choices that come with a long-term care event. In today's episode, we're going to cover the truth about long-term care. Is long-term care insurance really a scam? Is it worth it? What went wrong with the old traditional long-term care policies? Why doesn't the government pay for it? And most importantly, how you can protect yourself and plan wisely today. To dive deep in today's topic, we have Alex Fekete. Alex has spent the past decade helping individuals and financial planners plan for long-term care. Alex is going to be real with us, answer a lot of questions, and provide a lot of value. So, hey, Alex, why is long-term care planning such an important conversation for people in their 60s, in their 50s, 60s, and 70s?
Yeah, absolutely. When we think of long-term care planning, you think of how people allocate certain buckets of their nest egg for certain reasons. College, vacations, rental properties, whatever it might be. This is no different. It's a reallocation conversation. We're reallocating a very, very small portion of your portfolio to put a fence around everything else. And so, oftentimes when people work with financial planners, you're looking at solving for gaps in your retirement, whether that be an income gap or, a loss coverage. This is no different. This is building in income when your expenses are at their highest. And so that's why, at a base level, why I think long-term care planning is that important.
It's been interesting in my, 2.5 decades of being a financial advisor. When I started my career, long-term care was really never a conversation. Most of my clients were in their accumulation years. And I would say the last 3 or 4 years, a lot of our clients that are 65 and 70 and we've had these conversations with them, they've come to us saying, hey, I just took care of an elderly parent, right? I had to put them in a home or I have somebody taking care of them. And I asked them and I would say, well, kind of walk me through, that circumstance. What did you go through? Like, well, first of all, it was stressful. I had to take time off of work. So emotionally draining. And the second thing, what they found out is how expensive it is. The research that we've done shows that, for right now, if you had to put your parents into a long-term care facility or you wanted someone to come take care of them at their home, it's anywhere in the neighborhood of $80,000 to $100,000. What are some of the biggest misconceptions people have about long-term care? And, because people don't really plan for it. What are 2 or 3 big misconceptions that people have right now about long-term care?
Well, I think it's fitting for, your podcast talking about time being our greatest asset. One of the misconceptions is that, you think you're doing it for yourself. You're really doing it for your family. And when I talk about time being a great asset or our greatest asset, you're buying your family time. As you say, setting this up for a family member, it's a daunting task, right? People think as a misconception, well, we just have to pull money from the portfolio and pay for the problem. Well, no. The financial aspect is the tip of the iceberg, right? You've got care placement, care coordination, managing changes in care, whether that's, going from a home health care setting to maybe some kind of facility setting, dealing with taxes, dealing with an accountant. When we pull money from the portfolio, if you don't plan ahead, there's a huge ripple effect because you're paying a boatload in taxes to get the money from your portfolio. So there's just a laundry list of things that are involved. It's not just taking money from your savings account, paying for the problem. There's a whole laundry list of things that need to be solved for when long-term care happens. So that's kind of one misconception. I would say a second would be the government's going to take care of me. When we think about Medicare planning, Medicare is going to cover like your doctor's visits, some prescription drugs and things like that, but it doesn't cover long-term care. That's a big misconception. People think that, I have Medicare coverage, so I can go into a nursing home and Medicare will pay for it. Well, that might be true for 100 days. We're talking about long-term care, which means we're talking 2, 3, 4, 5 years of needing medical care. So some of those bigger misconceptions, the government's going to take care of me and I have enough money to take care of this problem. Those are, I would say, the two biggest.
I'm curious with that. I want to dive a little bit deeper because obviously, like I said, when my clients start talking to us about those stories, I would ask our clients, how does that make you feel? Well, the first thing they said, well, first of all, I don't want to be a burden on my kids. I think, we were talking to a potential client and they said, we always ask them, what's your plan if you need a long-term care event? And he laughs like, oh, well, my kids are going to move in with me. And I think if you're watching this right now and you're 55 or 60 and you have an elderly parent, I would strongly advise you to have a conversation with them and say, hey, mom or dad, if you go into a facility or you want to be taken care of at home, you basically can't take care of yourself. What's the plan? Where are we going to get the money? Do you have a long-term care policy? And we're going to talk about the common strategies that people use. But let's kind of dig deeper into that. Hey, I think the government's going to take care of it. Let's talk a little, because I've talked to people and say, yeah, I'm not really worried about it because the government's going to cover all of my long-term care. When does the government actually come in and help pay for long-term care? And what does that look like?
Yeah, sure. So there's really two ways. You got Medicaid. Medicaid being you have no money, right? So Medicaid is you got to spend your assets down to virtually $0. And from there, you will enter a Medicaid facility. Now, some of them are okay. Some of them are really bad. I would encourage you, if that's your plan, go drive to the 2 closest Medicaid facilities in your area and tell me that's where you want to spend the rest of your life, right? So, Medicaid planning is not, people that are looking to that type of planning are not usually thinking about how can I reposition other assets to prolong my income, right? They're already thinking, hey, I don't have that much to my name, so we're just going to figure out a way to spend this down and I'll have the government take care of me. So not the best plan for high net worth individuals. The second half of this is Medicare. Medicare is just going to be, again, doctor's visits, prescription drugs, things like that. Now, when we think of what Medicare does cover in the realm of long-term care, you have to have a qualifying hospital visit of about 3 days, and then you have a 2-week period to enter into a nursing home. And if the qualifying hospital visit and the time frame to get into the nursing home all happen seamlessly, when you go to that nursing home, Medicare will pay for it for 100 days. And in fact, Medicare is going to pay for the first 20 days. And then day 21 to day 100, you actually split the bill with the government. Wow. So Medicare doesn't exactly cover what we are calling long-term care. Cases where people have memory loss, dementia, Alzheimer's, things like that, that's 8 to 10 years. When we think of 100 days, that's a mere rounding error in this whole grand scheme of things. So that's really the two government programs that people often think, I have long-term care because I've paid my taxes, but that doesn't exactly work that way.
I have this quote here when I'm trying to educate clients. I say, long-term care is designed for when Medicare and your healthcare fall off. Is that a fair quote?
Yeah, absolutely. Absolutely. There's something to say about that. When Medicare becomes the solution, you're in pretty bad shape, right? You were in a hospital and now you're going into a nursing home. So, if it goes beyond the 100 days, that's when you have these, what I call a stop loss, right? You kind of use these plans to stop the bleeding from the portfolio and turn on turn on some income. So yeah, that's a good point.
Okay, so Medicaid, if you're watching this, listening, Medicaid is when you don't have a lot of assets, or you have to somehow spend all of your assets down. I think you said to $10,000, right?
It's 2,000.
2,000. All right. So that doesn't really, we work with clients that have generally $1 million or more net worth. So for our clients that are listening to this, or if you have at least $1 million in a portfolio, you're, most likely not going to go the Medicaid route. Medicare is only covering the first 20 days in a qualifying hospital, and then days 21 to 100, I think you said, then you have to split the bill, right? But that's what are, our clients now, the ones that are active and have a good lifestyle, we're seeing more people wanting to be taken care of at home, right? Because I think one of the stress points that the conversations I've had with our clients is like, yeah, we don't like any of these facilities. Like you mentioned, yeah, drive down to your nearest Medicaid facility. I don't think you would drop off the one person in your life you dislike the most there, let alone somebody that that you love and has been your parent. I want to talk about the difference between acute care, which is healthcare, and then chronic care, which is long-term care. And I have this visual here that we're going to use here in this episode. Acute care, healthcare talks about, it's medically based injury or sickness. It's short-term. It's restorative in nature. It's cured in a short period of time. An individual can usually return to their previous lifestyle, and it's paid for by public or private insurance. Versus long-term care, long-term care is physical based or mental based, cognitive impairment. It's long-term, 90 plus days. It's maintenance or supportive in nature. It usually cannot be cured. It's likely to affect the individual until death, and it's not reimbursed by private insurance or Medicare. Can you comment on that? Do we have that right when we're talking with our clients about the difference between acute care, which is healthcare, and chronic care, which is long-term care?
Yeah. Well, I think the key there is recovery, right? So acute care, being short term, maybe a couple months of recovery, those things are covered by your short-term disability, maybe FMLA, that's a family medical leave of absence. So, those things are covered by your employer, or maybe even some private insurance if you've got disability insurance. Long-term care is actually needing somebody else's assistance throughout the day. When we're talking about long-term care, there's these things called activities of daily living, right? You've got your transferring, your eating, your bathing, your dressing. Those types of things are what you and I can do, no problem. When you fail at those things, that's because you are either cognitively impaired or physically impaired so much to a degree that you can't take care of yourself. And so the long-term custodial care means somebody's got to be there with you, helping you perform these tasks, oftentimes, 12 to 15 hours a day, right? And we don't think that there's going to be an end to this. Now, I do have stories where a man has a stroke and needs in-home care as he's getting his physical therapy and speech therapy done, needing in-home care for at least a year and a half. But the physical therapy and the speech therapy worked, and he was no longer a risk to himself. So we do have stories where people turn benefits from these plans on and off, but that's a rare occasion. So long-term, meaning this is going to be, no end in sight.
All right. That's great. Thank you. Appreciate that. Now, what we talked about, the myths about the government, right? Now, the second myth, I believe, especially for high net worth folks, I think they just need more education, or what I've seen is sitting down with a potential client and they say, yeah, I don't think we're going to need it, / I'm going to self-insure, which I think is, when you think about that, to me, that means when and if it happens, you're going to pay dollar for dollar. And when I think about having some type of long-term care strategy, it's you're leveraging, some money that if you have a plan that normally that money would be passed to your kids. We're not talking about money that you would use to sacrifice your retirement, and now you're getting leverage on it. The second myth, let's dive a little bit deeper into that, is like, I'm going to self-insure, or, we're not going to need it. Let's talk about that. Why do people have that perspective?
Yeah, sure. first of all, misnomer, self-insure means that you're transferring the risk to yourself.
Yeah.
So it's kind of an oxymoron. So self-paying, I'll hear that out, but self-insuring it doesn't exist. So at the end of the day, for those self-payers, there's this idea that I have enough money to pay for it. And you know what? Most of your clients, I'm not going to argue, have enough money to maybe pay for 1 to 2 years of needing care. Now, their kids are going to be upset because obviously their $1 million inheritance is no longer that. But we're talking about something, 3, 4, 5 to 10 years. I often say to, if you're going to self-pay for long-term care, then why have medical insurance? Because you can self-pay for cancer treatment at that point. Cancer treatment's $1 million easily, right? If you look at needing care for 5 to 6 years, even in the state of Colorado, $1 million, no problem. So, when you think of that in a grand scheme of things, why would you? You've done such a good job saving for your retirement. Why not allocate 5 to 10% of your nest egg to make sure the other 95 to 90% never has to get touched? So that's kind of my 2 cents on that. The second part of the problem with self-paying is people often find that, I have assets. I can pay for long-term care. Well, assets don't pay for long-term care. Income pays for long-term care. So when you think of, I've got $1 million in my IRA, well, if you're going to pay $10,000 a month for in-home care, needing care at home, you might need to pull $13,000 a month from your IRA to get $10,000 after taxes. So there's this concept of basically using $1.30 to come up with $1. And that creates a ripple effect, right? I mean, you're now in your highest tax bracket in your 80s, aging at home, right? You're going into a higher tax bracket, you're paying higher Medicare premiums, and it's all because you're pulling money from assets that aren't tax advantaged. And then last but not least, when we think of long-term care planning, these contracts, you pay 70 cents on the dollar, right? So, we're talking about a discounted option that provides leverage and tax-free income, and you're taking advantage of tax laws. By self-paying, you're going full force to the government saying, here you go, IRS, take what you want. Whereas if you self-plan and do it with a private company, you actually can take advantage of that, avoid that.
Yeah, I like how you said our clients have done such a good job saving, sacrificing. And I've never met a high net worth individual that wouldn't want leverage on their money. And I think we're going to kind of go into more some of the other myths, which are, I think, traditional long-term care, which was a use it or lose it type of benefit, has really left a bad taste in people's mouth. And I don't think there's enough education on the alternatives, which we're going to get in a moment. But let's talk about the emotional side, because again, I don't think if you're watching this, unless you've gone through a situation where you've already taken care of one of your parents, and I've got a lot of stories of our clients telling us how emotionally and financially draining it was. But beyond money, how does lack of planning impact families emotionally from your experience in the stories that you've heard in your career?
Yeah, I'll give you a one-liner from one of my colleagues. He's been doing long-term care planning with multiple companies over the last 40 years. He's in his 60s and it's just been his lifelong career. He has a line where he tells people, if people ask him, what do you do for a living? He says, I make sure your kids are still talking at your funeral. And when you think of long-term care, not planning ahead and kind of banking on one kid or two kids or whoever to take care of you, that creates resentment. So I've seen that in my own life. My father-in-law, he and his sister, they just don't talk anymore. They had trouble splitting care for their parents and funding the care and, fighting over who gets what from the inheritance. And, it gets messy. What a beautiful thing is that this type of planning actually allows and gives the family is there's this thing called a care benefit concierge. One America is one of kind of the few carriers in the world here that we keep everything in-house from a claims perspective. So to avoid family conflict, we actually have this care benefit concierge. It's a care manager that helps with all the things we've been talking about: paying the bills on time, maximizing policy benefits, handling your doctor's records, helping with care coordination. You know, if the home care agency you hired at first doesn't have the skills needed to deal with the declining health of your mom or dad, well, we'll get somebody else in there and let us do the research on who that somebody else is going to be. So, you know, those are kind of stories like where we're talking about completely alleviating the family from having to become the care manager, the care provider, the family CFO. You know, that's the burden that is on these families. And a lot of times you got people that they live in different states than mom and dad, you know, and now somebody's got to move, and it just creates a whole whirlwind of issues when you could simply just have somebody else take on that burden. Does that help? And I can elaborate more if you
No,
think.
it does, because I don't think people think through. I mean, first of all, nobody wakes up in the morning and goes, I want to buy insurance, right? Think about, I've got car insurance, I've got health insurance, I have disability insurance, you have long-term care insurance, you have house. Like, a lot of times people's experience with insurance, I don't think is favorable. And unfortunately, when you're in your 50s and 60s, you're really focused on, hey, when am I going to call it quits with work? And I want to live, my last chapter of my life, I want to live it to its fullest. You're not really thinking about that. Where I've seen a shift, again, I've already mentioned this 2 or 3 times, is now my clients are like, oh, I just took care of a parent. Okay, that means I may go through it. I don't want to be a burden on my kids, but it's still like this thing where they think insurance is a scam. I mean, is long-term care a scam? I've heard that before. Hey, David, insurance is a scam. Long-term care is a scam. How would you address that question?
So I've heard this recently, and the gentleman who actually had mentioned that to me, he started to refer to group plans from the 90s, where these long-term care companies would come in and do a group plan for an employer or an employee setting, and then they just realized, like, hey, we didn't price this right. We got to just cancel everyone's coverage, and they sold it as being portable, and you can retire and have the long-term care coverage and all that, and then they just fizzled out and they're gone. So that is a real story that has happened in the past. So I think that's where maybe some of this scam concept comes from. Now, the other side of it, there's these things called use it or lose it plans. They're your traditional long-term care policy. This is something that you just pay as you go. As you get older, the premiums for the contract actually increase. So the closer you get to needing care, the more expensive they're going to make your contract. And then, oh, by the way, 30% of Americans never actually need long-term care. So there's 30% of those people are just going to die, and 100% of the money they put into the contract is gone, right? It's just kept by the insurance company. So those are kind of things why I've heard this scam concept. What One America doesn't, and what David likes is this asset-based plan. I'm not going to get too into it, but basically when you put money into this contract, it's moving money from one pocket to the other. What One America does is allows for us to pay for your long-term care needs when you eventually need it. But if you don't, there's a life insurance or cash value that passes back to your beneficiaries or your estate. So it's like, okay, we'll hold on to the money now, and if you actually don't need it, we'll give it back to the family. And a lot of times it's more money than you put in. So it's a hedge against the risk, but there's also, hey, look, we might never need this. We can actually get some money back. So I think that kind of gets around the scam concept. It's like, look, we're just going to hold on to it. It's always your money, right? It's always yours, but we're just going to hold on to it. And if you need it for a number of years, we'll be able to pay you for it. So
yeah.
Anyway,
you got to the that helps. You got to the next question I was going to ask, and I just want to go deep into it because we just sat down with one of our advisors sat down with a prospective client, They've had a traditional long-term care policy, which Alex mentioned, use it or lose it. You pay a monthly annual premium, and it comes with usually a 2 or a 3 year benefit for long-term care, sometimes for you and your spouse. We just sat down with a prospective client, and they just got their third premium. So the problem with those old traditional policies that were sold in the 90s or early 2000s, the premium was never guaranteed. And this one prospective client that we sat down with, they've had their premium increase 2 or 3 times. And they're like, okay, what's preventing them from stopping doing it? And we actually called with the prospective client, and we always ask this question is like, how many more times you guys are going to increase premiums? And of course, they're not going to tell you. And they're like, well, what are these other solutions? So I think, there's kind of two solutions that we kind of like to help clients. And again, it's generally looking at, first of all, it has to start with planning. I think the problem is that, when you're meeting with maybe just an insurance agent that is, commission based, compensated, where they're just trying to sell you something. I think those days are kind of going away, where you really want a financial plan. And in the financial plan, we talked about, for our clients that express a need and a desire to plan for this, we first want to make sure that their income's taken care of for themselves so they can live a good life. And the type of clients that we work with, they're passing away a lot of money. I mean, they can't even spend all of their money. They don't want to spend all of their money. So this is a situation where we're repositioning some money that we might leave behind, and then creating a situation where if they need long-term care, it's covered for them and their spouse. And then, like you mentioned, it's not a use it or lose it strategy. If they never use it, then there's generally a tax-free death benefit that's paid to their kids. So I think you're right. When I've heard this say long-term care is a scam, most of the experience that I've seen around that statement is, I know someone that bought a policy 10 years ago. Now the premium's going up, the benefit's going down, and that's going to continue. And that's because the insurance companies, when they fund these older policies, they put the money in their general account. And for a long time, interest rates were getting, 0 or 1%. And then more importantly, people are living longer than they have before, and, using these policies more than the insurance companies priced in. So now they're having to come back to insureds and having to collect more money. Where these hybrid policies, once you put in 100 or 200,000 or whatever it is, that's it. You're done funding it, and then you're either going to use it for long-term care. In a lot of cases, you can design it where that payment is for life, and then if you never use it, then there's money passed over to your kids. I think, hybrid policies for higher net worth clients is probably the more common way that I've seen people plan for it. And, companies like One America, and there's other companies that do it, I think have really kind of changed the marketplace and made it a more palpable strategy versus the old way. Would you agree with that?
Well, yeah. I mean, it's, again, back to the topic of high net worth individuals. The majority of people that look at this type of planning with One America have $500,000 to $5 million. And these are people that, you look them in the eye and you say, what's your biggest concern in retirement? They say, well, one of them would be running out of money. Another would be, not enough time with my grandkids. Maybe even not being able to do the bucket list vacations, right? Well, just to name a few, right? Well, when you think of allocating assets to specific needs, like you work with clients that they want a certain amount of income in retirement. So you put together assets that create the income they want to live off of, right? Being able to allocate some money to a long-term care need, again, something that's going to require monthly income year in and year out for a number of years, we don't know how long, that allows to go on the vacation, right? Like you don't have to worry about spending that extra money because you have allocated for all of these losses. You can, make the modification to your house. You can spend more time with your grandkids. If you think of a husband and wife scenario, if the husband needs care and has the wife taking care of him, that means she's got to take time away from her kids, her grandkids, her social, her hobbies, right? Vacation, whatever it may be. So that was kind of coming back to my original comment at the beginning is like, look, you're buying your family time, right? Giving them the ability to allow you to have professional care, but they don't have to be that professional caregiver. So there's a lot of emotional and financial impact on this. But when with all of that, the hybrid space, these asset-based plans, if we started with that, those traditional policies came out in the 80s where you pay into a contract and if you never need it, it's gone. If they started with a contract that you pay into it and if you don't need it, more money goes back to your family, I don't think those traditional policies would have ever existed. Right. So, but yes, to the point, that is the popular option these days. That's where the industry is headed.
Okay. Is there a best time to start thinking about this? Right. We meet with prospective clients and they're kind of coming to us a little bit late, and there's, sometimes people will call us. We just got a call from a beneficiary saying, "Hey, I'm about to put mom and dad into a home. We need to get them long-term care." What is the most ideal time, age that people should start investigating to see if a potential long-term care strategy is appropriate for them?
Yeah, I actually had a coworker do a video recently and she titled it, "You're healthy. Maybe that's the problem." And it was just kind of along the concept of, hey, I'm healthy today. I'm invincible. Nothing's ever going to happen to me. I'm good. I've got the money. If I do need it, we'll just pay for it. I think a lot of times that gets in the way. So when we think of the best time to do this, it's usually going to be in your 50s and 60s. And the reason for that is you're building a nest egg in your 20s, 30s, and 40s as you're working, right? When you hit your 50s, retirement's on the horizon. You've got $1 million in assets. Your house is, close to being paid off. And it's time to start planning for the what ifs when you hit your 70s and 80s, right? So your 50s and 60s, we actually had data that shows 65% of our policies are purchased between the ages of 58 and 64. So for what it's worth, I mean, it's either the industry doing a good job educating clients on planning ahead at the right time, or just the sheer fact that, when you get to those ages, you have the money to allocate, right? We're not talking to people in their late 30s, early 40s with this because they're trying to get to the point where they can start moving money around to protect and create a retirement plan. And then there's the health side to this. So yeah, as you said, your client that's going into a nursing home, unfortunately, there's very minimal. In fact, there's really only one carrier out there that may be able to help that person. One America cannot. There's medical underwriting involved here. So when we get to our 70s and 80s, usually we start to run into some health trouble. There was a speaker at a conference I was at recently, and he had a mention or a comment about long-term care. He said, people don't realize your health span is shorter than your lifespan for most Americans. And so, getting ahead of that before your health span fails, then we can help you and make sure that there's not going to be a hole blown in the side of the ship, so to speak.
Your health span is shorter than your lifespan. Wow, that is a I mean, I don't say a great statement, but that is such a true statement that people need to realize. We like to say, when we're working with clients, health is wealth. But your health span is shorter than your lifespan. That is, I'm gonna plagiarize that. I like that. Let's talk about.
It's all you.
Yeah, let's talk about what's unique about some of you look at everything in life. I think changes and gets better. You look at technology. You look at cell phones, microwaves, TVs. No different than strategies for retirement or like we're talking about long-term care planning. What I really find interesting and unique about some of these hybrid strategies that these companies have, and what I truly feel is being independent allows us to be a fiduciary at the highest level. Or what I feel is important, that being independent allows us to customize plans the best way we can possibly do because we have access to so many different strategies. What I really find beneficial for clients with the hybrid strategies is there's so many different tax benefits, right? If we go back in time and look at, like you said, the traditional long-term care market was, policies started coming out in the 80s, and really people would take their income and pay for them. But now you have these strategies that allow you to use unwanted RMDs. We work with a lot of clients that don't wish they never had to take an RMD because all it does is move in a higher tax bracket. So you could create tax efficiency through hybrid long-term care planning with unwanted RMDs. One of the things that we've noticed the last 3.5 years is our clients that are now in their 70s and older are inheriting assets from their parents. And, you can now use inherited IRAs to fund this. If you could spend a little bit of time about, there's also old annuities, non-qualified annuities that if you don't need, there's a tax benefit. Can you spend a couple of minutes just talking about the unique tax benefits that these hybrid policies have, and how it can help clients plan more tax efficiently for a long-term care event?
Yeah, it's actually pretty easy. I mean, you can Google HIPAA laws in 96 and the Pension Protection Act of 2006. And so if you go back to 96, and listen, this is just to say the federal government has basically been leaving us breadcrumbs for the last 25 years, right? So what happened is that in 96, the federal government looked at it ahead and said, wow, we have this baby boomer population. And when the baby boomers started going to colleges, guess what? We start building colleges. When baby boomers are now retiring, guess what we're building now? Assisted living facilities. Right. So the baby boomer population has shifted the country more than once. In 96, the government came out and said, these HIPAA laws, we're going to allow investors to use their life insurance death benefit while they're alive to create tax-free long-term care income. And so, and this was a reason for the federal government to say, we don't have enough tax revenue to pay for everybody's care. So they're giving investors incentives to say you can use your own assets and we're not going to charge you taxes on it. So HIPAA laws in 96, we can use life insurance tax-free for long-term care. In 2006, the Pension Protection Act was written into law. It actually didn't go into effect until 2010. But the Pension Protection Act allows for you to use what's called cash value life insurance or a non-qualified annuity. So cash value life insurance, you buy a life insurance policy that has cash value. That cash value grows. When it grows tax deferred. But when it's used for income, the gains in that account are taxable. The same thing that works for a non-qualified annuity. You fund it with cash, it grows tax deferred. But when you distribute the money out of an annuity policy, you pay taxes on the growth. So this Pension Protection Act allows you to actually reallocate those assets into a Pension Protection Act compliant annuity. And when you do need long-term care, all the money comes out 100% tax-free. So we have this tax avoidance law that you can take advantage of. And guess what, David, I've worked with clients numerous times where they're looking at their annuity that they've owned for 30 years. And they're like, the only reason we haven't touched this is because we're going to have to pay a boatload in taxes on it. And so the conversation then goes, well, if you don't have any income gap coverage for long-term care, let's take that annuity. And when you do need it, all the money's going to come out with zero taxes owed. So those are just some of the tax laws that you can take advantage of. Now, David was saying that using qualified dollars for long-term care. A lot of people, they don't want to touch their cold hard cash, right? Cash is king. I can go on a vacation, I can fix my house, I don't have to pay taxes on it because it's cash. So IRA dollars, being able to use those dollars and systematically distribute those dollars into a contract that will eventually pay tax-free long-term care benefits or a tax-free life insurance benefit if you don't need long-term care. So we're taking a taxable asset and transferring the taxes into these plans that will ultimately be tax-free income for either you or your family. So just a few kind of snippets on these tax laws that, I don't think a lot of people know actually exist, and we can take advantage of it.
Yeah, they don't, because I think, again, there's a bad taste in people's mouth from how long-term care was positioned 20, 30 years ago. And people with wealth think that either the government's going to take care of them / they've got enough money. But if they really meet with someone who understands both this type of planning and tax planning in general, you can really take advantage of some unique tax advantages with some of these strategies. So people just got to be open and willing to have a conversation.
Yeah. Pay more taxes in their 80s.
Yeah, exactly. We see it all the time.
Anyway,
what if someone's sitting here listening to this going, wow, okay, I'm now more open-minded. I want to have a conversation. What are some key factors families should consider when choosing a long-term care strategy? When it comes to cost, flexibility, and legacy planning. You could give our listeners a framework. If you could give our listeners a framework or just some things, because, we don't think there's a one-size-fits-all strategy for anyone, for any reason, right? People have their biases, but, what are some key decision or key consideration points that people should be considered when potentially looking at a strategy like we've been talking about?
Yeah, sure. So I think step one is your health. How healthy are you? Are you the pinnacle of physical fitness, or are you, taking a laundry list of prescription medications because you were drawn a shorthand and you've got some poor health? That is something we need to decide ahead of time, because these types of contracts, these types of investment vehicles, what we've done is we've created these life insurance based contracts and these annuity based contracts. And the annuity based contracts have less stringent underwriting. The life insurance contracts, although not strict underwriting, but more strict than the annuities. So we have to figure out health first, and then we can go down the next path, which is, what is the income gap we're looking at? In 20 years, and I'll just stick to the state of Colorado, your home state. In 20 years, home health care in the state of Colorado is looking to be about $132,000 a year on average, right? That's average. More for more expensive, less for less expensive, right? So we're talking about $11,000 to $12,000 a month. Now, you looking at yourself in the mirror as an investor saying, okay, we have about $7,000 to $8,000 a month of income in retirement. If we were to need care, we would have to come up with an additional, $6,000, $7,000 a month. So that gap is another great step for investors. It's like, okay, let's figure out what the shortfall is and let's solve for that shortfall. Because oftentimes people will look at this and say, well, it's cost $11,000 a month, so I need $11,000 a month as my policy benefits. Well, no. That's in my opinion over-insuring. You and your husband make, $80,000, $90,000 a year in retirement. The cost of care is going to be $130,000. So let's solve for about a $60,000 to $70,000 a year benefit. And the reason I kind of go above that delta is because, look, not 100% of your money is going to long-term care when it happens, right? You're going to have other financial obligations, maybe paying for the grandkids' college, or, helping with buying the first car, or maybe you don't have your house paid off, so I don't want to be so naive to say 100% of your money is going to go to long-term care at that time, but a majority will. Your hobbies are pretty much going to be put on hold. So we're solving for that income gap. So health, income gap, and then last but not least, take a step back and think to yourself, if you needed care tomorrow, where would you pull the income from? Would it be your IRA? Would it be your savings? Would it be that annuity that I was talking about? And then have that conversation with David to say, hey, if we needed it tomorrow, this is what we would use. And then he can turn around and show you using a portion of that money to then solve for the whole problem, right? So kind of coming to realize, what would actually be the resource of this income, and then allocating that ahead of time so that in some cases, with One America anyway, that income will never run out. We have that unlimited benefit that I know you're aware of. So health, income gap coverage, and then what asset would we use? That's usually a good way to start this conversation.
That's great. I think that's great advice. Really appreciate that. Man, I feel like you and I could talk about this for hours. I just got one last question for you. BAM Advisory Group, obviously we're known for high-level financial planning, but what we say to our clients, what we're really known for is protecting what's priceless. That could be their time, their energy, and their family. If I were to ask Alex Fekete, what is protecting what's priceless for you as it applies to your personal life and business life, how would you answer that question for the audience?
What is protecting what's priceless for me? Meaning what's priceless for me?
Yep.
My daughter is about 40 feet that way, and she's 7 months old. And I'll tell you what, I got a little extra meat on my bones these days, and a little less time for the gym and things like that, taking care of a little one. But, being here for her in the long run, being here for my wife in the long run, and making sure that I'm never something they have to worry about. I want to be the protector. I want to make sure that they have everything they need and more. Everyone always says, I want to give my kids a better life than what I had. And that is absolutely true. And I guess you don't really realize it in full until you have a child. But at the end of the day, those two women in my life are hands down my number one priceless priority, right? Time with them, quality time with them, right? I don't want them to be, worrying about me being sick or me being hurt or anything like that. So, very new, because again, she's 7 months old, but that is going to be my answer, and probably will be for the rest of my life.
Great answer, man. Congratulations, new family.
Thank you.
Thank you for taking time to talk to our, audience about, the current state of long-term care, why they should consider it, trying to get rid of the old way of thinking, and then, providing a lot of value. So Alex, thank you so much. Really appreciate it. And that's a wrap.
This was fun.
Yeah, man.
This was really fun.
If you're curious about how we help people protect what matters most in their retirement, and you just want to see how our process works for you, give us a call or visit our website at www.bamadvisorygroup.com. You can schedule a 15-minute, no cost, no obligation, no pressure phone call with one of our advisors to get all of your questions answered, to understand your options, and for us to be able to provide you with more information and clarity. And if you're enjoying the show, don't forget to like and subscribe. Thanks again for watching. We'll see you all real soon.